Ho, 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 Dr. Larry Burchett. Happy New Year's. I want to do a little video to talk about, let's all be honest about what happens a lot over New Year's. Alcohol, we drink a lot. Let's talk about how to prevent that, but let's also talk about what we can do for you in the ER if you need to go there for drinking too much, right? So, first, obviously, prevention. What things help if you know you're going to go out and have a good time? Number one is food. Put food in your belly and eat something, I would say, throughout the evening. Two is water, right? Make sure the less food, the less hydrated and water you have, the more effect alcohol is going to have on your system. And then pace yourself. The amount, so that, the toxicity, the drunkenness is absolutely related to the strength of alcohol and the rate at which you consume it. Prevention, be careful. I think you know those things. Let's talk about, for you or for friends, what we can do for you in the ER when somebody really should come to the ER for alcohol poisoning or for drinking too much. I've heard so many people tell stories. Oh, I went to the ER, got my stomach pumped. I've never pumped anybody's stomach for alcohol poisoning ever. Why? Because when you drink alcohol, it's absorbed so rapidly through your stomach that by the time people are in the ER, they're already drunk. Me putting a tube down their throat into their stomach and removing whatever else is in there really isn't going to help them get any better. It's really kind of a form of torture. I've never done that. What do we always do? We give salt water, normal saline. It's basically just to rehydrate someone. Not only, it's better than water, right? So, and you can use this on your own, like, oh, I need to drink a lot of water. That's true, but you also need to get those electrolytes, mainly that sodium. Salt water is the best. Gatorade, Pedialyte is probably the most common things that people drink to rehydrate. But you can also drink water and then eat something that has a little bit of salt in it. That will better rehydrate you than water alone. So people come in, and I'll commonly give them 1, 2, or 3 bags of fluid, whatever, how much, and it depends on how drunk they are. I've had people that have had to take a whole day to sober up. I mean, they've been really intoxicated. So, when should you come to the ER? Number one, I would say, is intractable vomiting. So if people continue to vomit, can't keep any fluids down, you're not going to be able to rehydrate at home. You need to come into the ER. We can give you an IV and not only give you fluids, but give you medicine to stop the vomiting and to knock it out. That's Zofran. It's a great medicine. It works really well. And it often helps people to feel a little better because they're so nauseous and sick. So that's definitely something we can offer in the emergency room along with the fluids. 2 is obviously aggressive fluid rehydration. It doesn't speed up the rate at which your body metabolizes alcohol. That's based on your liver, and that's just a 0.04% per hour. Whatever the thing is, it's an hour. It just takes time for you to, as we say, metabolize to freedom. Your liver just has to break down the alcohol and get it out of your system. So fluids don't help you to sober up any faster in that sense, but it does help to prevent some of that dehydration-related hangover stuff for the next day. So fluid is absolutely helpful. The third thing that I want people to think about, especially with friends and somebody gets drunk, maybe they fall. If somebody falls and hits their head, boy, really think about bringing them to the ER to get a scan to make sure they don't have a bleed. I've had so many patients that they've fallen, they've hit their head, and I've thought everything looks fine. There might not even be a lot of bruising. They may be acting totally normal, but they fool me because they're drunk and they've got a bleed in their brain. I've actually missed this before. When you're drunk, normally, as a doctor, when somebody is a normal adult, can communicate everything, they can tell me everything that's going on with the body that they feel. When you're drunk, those signals are numbed. You don't know what's going on. I can't get the information that I need. You're not as reliable. And so somebody may not even have much of a headache. They may not have much symptoms. There may be something wrong, even though they appear to be totally normal. So if somebody falls and hits their head, really think about bringing them in. Scan is an easy thing to do. All ERs have it. You can be safe that everything's okay in the brain. That kind of trauma, I really want you to think about. All right, so in closing, prevention. Make sure you eat something, stay hydrated throughout the night. That's the best way. And do it in some degree of moderation. If you happen to need to come to the ER for intractable vomiting, for rehydration, or for evaluation of trauma and head injury, those are great reasons to come in. Don't hesitate to do it. That is what we're here for. I hope you have a safe, enjoyable New Year.